For millions around the world, problems start even before childhood. According to a report just issued this week by the non-governmental organization Save the Children, each year around the world, 1 million babies die on the first day of their lives. What's more, there are more than 1 million stillbirths each year. And newborn deaths, those within the first 28 days, account for about half of all deaths of children aged 5 years and younger. Joining me now to discuss the report is Mike Kiernan. He's the Advocacy and Public Affairs Director of Save the Children. And your report cites the leading causes of newborn deaths. And we have a graphic we can throw up and kind of illustrates them. And there's really three issues that jump out at us. Prolonged labor is one of them that comes up. You look at these three, and as you glance at these, it looks to me like some of these you ought to be able to prevent. How many of them can you prevent out of the top three?
You can prevent all of them. Yeah. And you can do it inexpensively. You can address you can help premature babies in a number of very simple and effective ways. You can help babies breathe when they can't catch their first breath at birth with some very simple stimulation techniques or a bag and mask. And you can prevent infections. You can use something like this, 25 cents. This costs 25 cents, and this can help clean a baby's umbilical cord immediately after birth. And if you provide this effectively at scale, you can save many thousands of lives just with a simple device like that.
And this is, as you say, it's just 25 cents. That's a very little investment. What a big payoff when you think about it.
And a lot of these techniques are basically simple. What's complicated is bringing them to scale, making them available to every mother and every child in every country. I mean, we have 300,000 babies dying on the day they're born in India. We have 11,000 in the US. We have 50,000 in China. Most of those babies are dying from causes that are potentially preventable.
You know, and then to see something like this and know that it costs next to nothing to prevent it. Let's look at some other aspects of this report.
Sure.
It talks about specific regions that have higher rates of newborn mortality, primarily Southern Asia and Sub-Saharan Africa. We have this graphic here. It's amazing. 2/3 of newborn deaths occur in just 10 countries. 25% of all newborn deaths happen in India, 10% in Nigeria. What's the cause for that, would you say?
Well, I think let me take China as an example of a country that has made enormous progress. China, in the last 25 years, has reduced newborn mortality by 60%. They had 25 deaths per 1,000 births back in 1990. Now it's down to 9. It's not as good as it will be or could be, but it's tremendous progress. And the solution that China came up with is building a very strong healthcare system. They've strengthened their health care system. And now, today, in China, almost every mother is able to go to a hospital or a health center and have her baby. 25 years ago, that wasn't happening in China. Most mothers gave birth at home. In Africa, nearly half of all mothers give birth at home. And worldwide, 40 women every year give birth without any trained assistance. So our report calls for a rapid and smart increase in the number of health workers who can provide the quality of care that mothers and newborns need. And it can be as simple as knowing how to apply to swab the umbilical cord after birth, as opposed to using some sort of something that is unsanitary.
And one of the things you say, it doesn't have to be a doctor, it can be a midwife. There's a number of different ways to tackle this.
Correct, that's right.
Michael, thanks so much for coming in, certainly appreciate it. Very important stuff.